on the health of the continent. Leaders meeting to discuss how to boost finances for the sector say private investors should be encouraged to commit more funding. Statistics show that more than half of Africa's population currently lacks access to essential health services, and millions die every year from commonly preventable diseases.
The ECA has just estimated in a report that
only 2 out of 55 African Union member states currently meet the target set by the African Union of dedicating at least 15% of government's budgets to health. These African leaders attending the African Union Summit in Ethiopia are now challenging themselves on the need for more financing in health.
When one family member falls sick, chances are an entire family will sink into poverty. And this was one of the main reasons why we decided that we were going to make healthcare, an investment in healthcare, a central theme through what we are calling our universal healthcare provision.
We will get better results if we work together. For example, cheaper prices by negotiating and procuring as a bloc. We also have a lot to learn from each other's experiences, implementing programs such as universal health insurance and community-based healthcare.
International financiers of the health sector in Africa say even as the continent seeks domestic resource mobilization for health, international support must be maintained.
In the next few years, this notion of commitment to these partnerships will be tested. The rich countries who've been great donors need to reaffirm their commitments despite all the distractions and challenges that they face. That'll start with the Global Fund in October, and the year after that with the vaccine replenishment.
Meanwhile, the new Partnership for Africa's Development, NEPAD, an economic development program of the African Union, will have its name changed to African Union Development Agency. The AU says it aims to strengthen its efficiency and regional integration.
We need to create in the next 30 years 400 million jobs for 400 million Africans who are already with us. They are not waiting for 2030, 2040 and 2050. They want jobs now. So in order for them to have jobs now, we need to put our efforts together, because it's by putting our efforts together that we'll be able to solve this challenge.
The details of the operations of this new development agency will be discussed in details by the heads of state in their meeting. The outgoing chair of the African Union, Paul Kagame, is expected to present the final report on the proposed AU reforms. The reforms will see an AU with reduced number of commissions. The reforms are aimed at ensuring efficiency of the continental body in its business. Coletta Njohi for SABC News, Addis Ababa, Ethiopia.